Healthcare workers have long been exposed to high-stress environments, but the compounding pressures of recent years, chronic understaffing, emotionally demanding patient care, and extended pandemic fallout have escalated burnout to unprecedented levels. This form of emotional exhaustion, marked by fatigue, detachment, and cognitive overload, is not just a personal issue but a systemic one, with implications for care quality, safety, and staff retention. In response, a growing body of research is exploring innovative, scalable interventions to help restore the psychological resilience of frontline professionals. One of the most promising tools is nature-based virtual reality, VR immersive digital environments that simulate forests, beaches, rivers, or mountain meadows. When tailored specifically for healthcare settings, these brief but restorative VR sessions offer not just escape, but true recovery from the physiological and emotional toll of caregiving. The appeal of VR lies in its ability to override the immediate stressors of an environment without requiring physical relocation. A nurse may step into a break room in the middle of a double shift and, within seconds, be transported to a quiet coastal scene where waves lap gently and seagulls call in the distance. A physician between patients may pause for a few minutes in a virtual forest where sunlight filters through trees and wind stirs the leaves. This immersion in nature, though digital, triggers real neurobiological shifts. It activates the parasympathetic nervous system, lowers cortisol, reduces heart rate, and helps shift the brain out of the hypervigilant mode that dominates during medical crises. Even sessions as brief as 5 to 10 minutes have been associated with measurable reductions in perceived stress and emotional fatigue. Nature-based VR works particularly well because it addresses burnout on multiple levels: physiological stress, emotional exhaustion, and cognitive overload. The structured yet low-effort nature of these environments gives the brain a break from decision-making and moral distress, two major contributors to clinician burnout. Unlike abstract meditation practices that can feel cognitively demanding when someone is depleted, VR nature requires no prior experience. It is passive yet deeply sensory, engaging vision, hearing, and often proprioception, allowing the body to feel grounded and the mind to gently decouple from the relentless logic of clinical work. Importantly, the environments are customizable. Forests may appeal to those seeking shade, quiet, and depth. Beaches to those drawn to openness, warmth, and rhythmic motion. Some programs even incorporate guided voiceovers with themes of release, self-compassion, or boundary setting, emotional skills that healthcare workers often neglect in the course of prioritizing others. Others offer purely ambient experiences, letting the scenery do the work without words. This flexibility allows for a personalized approach to emotional restoration, which is critical given the diverse needs of healthcare teams. Emerging pilot programs in hospitals and clinics have already shown promising outcomes. In one study, ICU nurses using nature-based VR during breaks reported not just lower momentary stress, but improved sleep quality, reduced irritability, and a greater sense of meaning in their work. Another study found that physicians who engaged in short daily VR forest sessions were better able to emotionally disconnect from patient trauma at the end of the day, an essential skill for long-term psychological protection. Unlike traditional wellness interventions, which often require time, cognitive effort, or social interaction, all potentially draining, VR offers an immediate, private, and non-judgmental space to decompress. What makes nature-based VR particularly suited to burnout recovery is that it doesn't pathologize the user's state. It doesn't ask the healthcare worker to fix themselves, but rather gives them a moment of beauty, stillness, and ease in a landscape that is alive and generous. This is a form of psychological rebalancing that, over time, can restore empathy, reawaken motivation, and rebuild the emotional scaffolding that burnout erodes. As the healthcare industry looks for scalable, compassionate ways to support its workforce, integrating nature-based VR into staff wellness protocols could become not just a luxury, but a necessity. These sessions won't replace systemic change, nor should they be expected to. But in giving caregivers a taste of rest, real rest, the kind that touches the nervous system and the soul, VR becomes a bridge to recovery. It reminds healthcare workers of their own humanity, which is the very source of the care they give others. And in doing so, it offers something both simple and profound, not escape from the work, but renewal within it.